Hello everyone. Yeah, this is Dr. Mukesh Budhwani. I'm a MD physician and a diabetologist, and today I'll be discussing in a very interesting topic is about heart attack. I know why I have choose this topic specially, and I wanted to discuss and inform it to everyone. The reason is I have been seeing it this the concern of heart attacks in a very young age. It is most of the times what I am saying is patients are not being able to understand the reasons, causes, and definitely they are not able to even understand that whether they are suffering any kind of cardiac ailments. So to discuss it more further and more in a brief, to explain that what are the causes of heart attack, what we should be knowing about heart attack, how to understand the heart attack, whether any person is having a heart attack or not, and what ways we can be doing it to prevent it in future. So to begin with, we know what is heart. It is definitely one of the very important and vital organ of our body, which helps in pumping the blood from and the muscles of the heart, which pumps the blood in and out, and filter our blood and transfers it to the other organs of the body. So it is very important because heart provides the oxygen and blood, and definitely the oxygen which we require comes from the blood. So it is becomes a very important function of our body, the circulation of a body, that oxygen requirement is fulfilled by the circulation of blood, which where the heart plays a very major and vital role. We know that in the Indian scenario what we are treating these days, that Indian scenario, the young hypertensives, young cardiac patients, the number of young cardiac patients are increased, and definitely everyone would be hearing that young patient around with the age of 30, 40, marathon runner, doing regular exercise, suffers from a heart attack. So is it something whether he was not aware that whether he was going with such kind of disease, or maybe there are some people around with in him when he tried to explain his symptoms, they were not able to understand whether he is having any kind of cardiac ailment. So to make it more simpler for my patients, that definitely what could be the more precaution, what are the symptoms what we should be facing more, seeing more, understanding more, and what are the preventive measures we can take to prevent the heart attack. We know that definitely there are multiple factors which deals with shows that the risk factors for heart disease. What are that multiple factors? Number one is high blood pressure, high cholesterol levels, obesity, which is overweight, more weight, smoking, alcohol, lot of junk food intake, lot of salt intake. So we know fried items, sedentary lifestyle, and definitely last but not the least is the stress where everyone is facing these days, whether it's a work related stress, personal stress, family stress. But stress is definitely increasing day by day, which has become one of the major reasons for facing the kind of issues what we are especially related to heart. So when we talk about high blood pressure, we can measure it. High cholesterol, we can definitely always know, everyone can monitor their cholesterol levels by regularly doing regular checkups. They can definitely understand the BMI. They can meet a dietitian to reduce the weight, to understand the dietary changes, lifestyle modification. What we are discussing, that lifestyle modification is required to reduce any kind of risk factors related to heart attack. Symptoms during heart attack can vary, but there are some classical symptoms to talk about in more brief. Chest pain on the left side, left retrosternal area is one of the major symptom. Chest pain radiating to left arm. Chest pain can be radiating to jaw area. Pain can be radiating to back area. But chest pain related to radiating to left arm can be a classical symptom for cardiac heart attack. One of the main symptom associated can be a sweating, restlessness, difficulty in breathing is one or more of the classical symptoms for heart attack. There are a lot of times we know that diabetic patients can face a silent heart attack, where sometimes they are not much aware that they might not get the classical symptoms of heart attack, but still they feel some kind of restlessness. So definitely going for regular checkups, meeting the physicians on a regular basis becomes an important factor in terms of either a treatment precaution or diagnosing your cardiac ailments, which is very important. A lot of tests what we can be done to make it, what test can we do to understand whether are we facing any kind of risk factors for heart attack. Is one is checking their blood pressures, doing an electrocardiogram, which is known as ECG. Doing regular ECGs can always tell you whether do you have any kind of LVH, which is a risk factor for high blood pressure. In terms of any kind of restlessness, please go to your physician or a cardiologist, get your ECG done, so then you know that whether are you facing any kind of angina, ischemia or a MI at that time. If you want to know if you want to do a regular checkups to know whether you have a risk factor of heart attack in future, stress test, which is TMT, treadmill stress test, is one of the very important test which can guide you and inform you whether you are facing any kind of risk in future or maybe in sooner future for heart attack. Echo will tell you the function, 2D echo. Echocardiography will tell you whether the cardiac function, heart function, whether you are having a regular good heart function or not. You can do regular blood tests like cholesterols, cardiac enzymes to know whether you are at any kind of risk for heart attack. So there are multiple investigations available. So see your physician to know whether you are any kind of risk factors, because it's not only the lifestyle which is at a risk of heart attack. You can have a genetic predisposing genetic factors, a lot of other factors, high platelet count, your thickness of blood. So a lot of other factors also can let you or take you to the risk of heart attack. So regular checkups will definitely keep you on a safer side. To end up it with, we know a good lifestyle modification, eating a healthy lifestyle, eating a healthy food, reducing oily and fatty food, reduce risk factors for heart attack. I advise you that get your regular checkups, eat a healthy food, maintain a lifestyle modification, good healthy lifestyle modification, avoid sedentary lifestyle, avoid too much of stress, avoid smoking and alcohol, and definitely do your regular checkups. Thank you very much. This is Dr. Mukesh Budhwani. I am a consulting physician in Apollo Clinic, Viman Nagar, and I am dedicated physician here since more than 10 years as a physician and a diabetologist. And I thank you very much for listening for the information for heart attack.